Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, March 12th. I'll now turn things over to Dr. Fitzgerald for the end of the week update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have one new case of COVID-19 in our province in the Eastern Health Region, which is related to travel. The individual is between the ages of 40 and 49. The total number of cases in our province is now 1,012. There have been 11 new recoveries in Eastern Health and 1 in Western Health, leaving 57 active cases in the province. And 3 people are in hospital due to COVID-19. A total of 119,611 people have been tested to date. We recognize the hardships that the pandemic and its restrictions has created for rotational workers and their families. And now that the outbreak seems to be behind us, we are reintroducing modified self-isolation for rotational workers working in Canada from non-outbreak sites, effective immediately. The modified self-isolation policy is somewhat different than before. These changes were made to reduce the risk of the spread of the COVID-19 variants of concern, while balancing the need to support improved work-life balance and mental health for domestic rotational workers. It's a 4-stage process with increased testing and a gradual easing of restrictions with the testing intervals. Upon arrival in the province, rotational workers can book their COVID test through the online self-assessment and testing referral. While awaiting the results of this first test, the worker should isolate away from family members as much as possible, avoid close contact with family members, and wear a mask if they must be in the same room as other members of the household until a negative test is received. If the arrival test is negative and the worker does not have symptoms, then the worker is no longer required to isolate away from family and may participate in limited activities. They can interact with family members that live in their household. Maintaining physical distance from household family members is not necessary unless they develop symptoms. They can go for a walk or drive while maintaining physical distancing from those outside of their household. They can spend time at their cabin. They can attend non-urgent medical appointment if they are asymptomatic and disclose that they are a rotational worker. At this point, the worker is not permitted to enter public places such as grocery stores and banks, to interact with people outside of their household bubble, visit family members outside of their household, or allow other people to enter the household, or frequent common spaces when they live in a condominium or apartment building. For stage 3, the rotational worker can book a test for days 7 to 9. After receiving a second negative test, and provided they still do not have symptoms, then the worker can continue with modified self-isolation for the remaining 14 days. At this point, they can interact with people outside of their household bubble when wearing a mask and in accordance with alert level guidance for households, and they can enter public spaces such as grocery stores and banks. At this point, they cannot enter or visit long-term care facilities, personal care homes, or acute care facilities until 14 days after their return home, except for exceptional circumstances such as end-of-life visitation. They must not attend gatherings such as funerals, burials, or weddings, or visit crowded spaces. In stage 4, if the worker, if they continue to be asymptomatic, will need to have a test again either on day 11, 12, or 13, with day 12 being optimal. Provided they still do not have symptoms, modified self-isolation ends on day 14. If rotational workers are required to return to work prior to completing 14 days of isolation, they are permitted to do so if they do not have symptoms. Rotational workers must be available by phone and email, as they will be contacted during their self-isolation period to see if they or their family require support. These calls also serve to provide rotational workers with a point of contact for any questions they may have around precautions the family should be taking. All rotational workers are required to undertake a daily symptom check. A reminder email will be sent from the email address the worker provided on the travel form. The reminder email will contain instructions on the daily symptom check. If at any point during modified self-isolation, a worker or anyone in their household develops symptoms, even if mild, testing should be arranged right away, regardless of a previous negative test result. If all of these requirements are followed, anyone living in the same household as a rotational worker does not have to self-isolate. They can attend work, school, and daycare. Household members without symptoms can also avail of testing on day 7 to 9 if they wish. If the rotational worker does not want to avail of modified self-isolation, they can choose to self-isolate together with their family for the full 14 days, meaning no one can leave the property unless urgent medical care is required. Modified self-isolation does not apply to international rotational workers returning from outside Canada. International rotational workers must self-isolate upon return for 14 days. The quarantine order from the Government of Canada remains in effect, requiring those returning to Canada to self-isolate for 14 days. It is very disheartening to hear of situations where rotational workers and their families are being stigmatized, particularly so children. So I want to be clear that this is completely unacceptable. If you are a parent or caregiver and witness any ill treatment, discrimination, or bullying of a child for any reason, you must take action. Parenting is hard and is even harder in the time of COVID. It is a tremendous and even overwhelming responsibility to raise children to be compassionate and respectful adults. Act by example. Little ears are everywhere. Your children see when you are afraid and may carry your worries and anxieties as well. So instill empathy. Ask your child to imagine themselves in another child's position and how they must be feeling, and teach them the golden rule to treat others as you would like to be treated. Children learn what they live, so please remember that the lesson your child learns in this pandemic will have a lasting impact on how they treat others throughout their lives. No one is too old or too young to learn the importance of treating others with respect. Today, we are expanding the pre-registration system for the COVID-19 vaccination to include home support workers. These workers are part of phase 1 in our vaccination plan as they work supporting individuals living independently, many of whom are at an increased risk of severe illness from COVID due to advanced age. When pre-registering, home support workers will need to indicate if they are employed by an agency or by a client of the provincial home support program. As a reminder, home support workers and individuals 70 and older can pre-register for their vaccination by visiting the Government of Newfoundland and Labrador's COVID website. If you don't have computer access, you can call toll-free 1-833-668-3930. The phone lines are open every day from 8 a.m. to 8 p.m. We are very encouraged by the interest in being vaccinated. It's wonderful to see. Our phased vaccination plan with priority groups is available on our website. Please be patient as we work through priority groups. Public announcements, either by us or your regional health authority, will be made when we are ready to begin vaccinations for each priority group. I understand that the Cancer Care Program has been receiving questions from patients and healthcare providers about the COVID-19 vaccine. We encourage all clinically vulnerable patients, including patients with cancers who are undergoing chemotherapy or other treatments that can affect the immune system, to get the vaccine as soon as one is available for them. We are closely following the reports of adverse reactions associated with the AstraZeneca vaccine in Europe. At this time, there is no indication that the vaccine caused these events. Furthermore, Canada has not received any of the batches under investigation which were manufactured in Europe. Initial investigations indicate that these adverse events have not happened in vaccinated people more than would be expected in the general population. As a recap, for those who may have just joined, we have one new confirmed case since yesterday's media advisory, and the total number of cases in the province is 1,012. We need to summon all of our patience as we face the months ahead. Each of us must carefully balance how we go about our daily lives with the risk of COVID still at hand. I am confident that we can adapt and persevere to reach the end of this pandemic together. Let's do so with kindness, respect, and compassion for one another. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'm relieved with how this week has shaped up. Single-digit numbers and asymptomatic testing showing that we have contained the outbreak from 4 weeks ago. Vaccine shipments coming into the province and getting into ERMs. The Avalon moving from alert level to alert level 4 and the rest of the province moving to alert level 3. Our children starting to get back into the classrooms. Some businesses starting to reopen, albeit with some restrictions. The testing changes Dr. Fitzgerald announced for rotational workers means they will get to spend more time with their families and somewhat ease the stress of what I only can imagine is an already incredibly stressful situation. This is all positive momentum. I feel optimistic about the weeks ahead, and I hope you do too. 1 year later, the pandemic has taught us all many, many hard lessons. That we need to take better care and protect our elderly and the most vulnerable in society. That we must be prepared for large-scale events like this in the future. We pay our respects to those who lost their lives here and around the world due to the pandemic, but we honor them by being vigilant with our health and safety. I'll now invite Minister Haggie to have a few brief comments.
Thank you very much, Premier. I will be brief. There's not an awful lot to add to your comments and Dr. Fitzgerald. It's day 369. With the move to level 3, I'd like to take this opportunity to show my appreciation to the Salvation Army, Port aux Basques particularly, but provincially, for providing an essential service to an essential group, the truckers who come across the Gulf, with the opening of restaurants in that area over the course of the weekend. That service will now wind down, and I thank them for providing it. The numbers are looking good. We are down to 57 active cases today. And as you say, the vaccine rollout is on track, and indeed with AstraZeneca is actually ahead of schedule as we're vaccinating now frontline first responders. This is a marathon with hurdles, and we need to hold fast. And I would just close by echoing Dr. Fitzgerald's comments that if nothing else, we should spread kindness and not COVID. So with that, Premier, I'll hand it back to yourself.
Thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, in the past you've resisted entry testing, saying it gives people a false sense of security so they might not follow their 14 days of isolation. What changed your mind?
B117, quite short and sweet there, but yeah, we just know that this variant is much more easily transmissible. Our experience with it and the experience of in other jurisdictions has shown us that it can spread very rapidly through a household. So we want to make sure that people coming in aren't infected. We know that as time goes on, we're going to see more of this variant circulating in other parts of the country. Ontario has said that up to 40% almost may be related to variants of concern there. So we do need to be extra cautious about that, and because of how fast it is transmitted, we know that when somebody presents with symptoms, their contacts may already be transmitting it to other people. So given the situation with rotational workers, where we knew that we wanted them to be able to spend time with their families, we felt it was best if they had testing when they arrived, and then the day 7 testing, of course. And then because they have this the modified isolation, that they were still going out into the community, that we wanted to have that 3rd test just to make sure that we were picking up any cases, because unfortunately B117 is a tricky little virus, and we had people get transmit it very quickly in a seemingly shorter incubation period, but then we had a group of people that seemed to transmit it to have a much longer incubation period as well. So we're trying to respond to what the evidence has shown us, and this is the policy that we end up with, that we feel balances the risks and benefits the best way.
There are rotational workers who work on ships on the Great Lakes. They never leave the ship. They're essentially kind of bubbled the whole month or so that they're working there. They consider their situation to be the same as Marine Atlantic. Those workers are allowed to get a test and then don't have to do any sort of further isolation. So why are Marine Atlantic workers being treated one way and workers on other ships being treated another?
So some workers on ships, and it's variable. I don't know the details exactly of what's happening with those ships in particular, but we know that some people who are on ships, they go in, they're on the ship for more than 14 days. Nobody is symptomatic. Nobody leaves. Nobody comes on. We consider that a closed system, and those people, if they come back into Newfoundland and Labrador, or if they come back through a charter flight, for example, then they don't have to self-isolate. So there are some exceptions to those rules where we know that the people involved would not have been exposed. I can't speak to that situation specifically, but we have considered that.
Okay, thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. When does this modified self-isolation policy come into play? Is it for those who have already been home for 7 days, they can arrange testing and participate in the second half of this? Or is this only beginning tomorrow and it's for those who have arrived?
No, it's starting today, as of now, and it's for people who are coming in as of now.
Okay, thank you. And just to clarify on Peter's question there, so there are exemptions for those who are in closed system ship situations?
Yes, those. So people who are on ships where, they go on, they're on for more than 14 days, nobody leaves, nobody comes on, nobody gets sick, those are considered closed systems. Yeah.
Thank you.
Our next questions are from Noah Shepard with VOCM. Please go ahead.
Thank you. I was wondering if you could clarify the restrictions on hospital visitations for loved ones under Alert Level 4.
So hospital visitations are generally developed with the regional health authorities, and public health will be consulted on it, but we don't actually make the policy for it. So I certainly don't want to speak out of turn to that. Is there a particular question that you were wondering? Because I don't know that it's actually tied to levels per se as much as it is to what's happening with virus circulating and that sort of thing. But I can try to answer a specific question.
We've had calls about hospital visitation being denied for loved ones in life and death scenarios. So I was just wondering if there was any clarification of that for the Avalon or Eastern Health Region.
So I know that there have been allowances for essential people in visitation, but I don't know, Minister, if you have anything further to clarify there.
Yeah, thank you very much, Dr. Fitzgerald. The whole issue of hospital visitation has been one of the hardest that we've had to deal with through the pandemic, and we've had long discussions here about that and about long-term care. There is a provision for an essential person to be designated for those people who require it for support, be it physical or emotional. There are also exemptions available for people who are in precarious or life-threatening clinical situations, and we have a whole different system for end-of-life care, and that's very context-dependent, situation-dependent on the family and the illness. The key here is if there is an issue with visiting or support people, this is a discussion between the family and the director or team leader on that unit, because there may also be issues on the unit itself in terms of, is this a COVID ward, for example? So it's very difficult to do other, in this situation, than lay out some general principle. But the system is flexible. It is still, unfortunately, predicated and based on the idea that we have to be careful the number of people we let in simply because of the risk of transmitting this virus, either bringing it into the hospital, which is bad, but taking it home is no better either.
Thank you very much.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. We've had a couple of people contact us saying they're very anxious about not having gotten an appointment yet for a vaccine. These are people 85 and older. Is it unusual that they would not have been contacted yet?
I think for a lot of people, it may, so if you registered and it said you are registered, then you are, and the RHA will get your name. It may be that they're just waiting to have a clinic nearby, and you know, depending on when they get to that area. So they'll be trying to book someone into the clinic closest to them, and it may be that some clinics are going to be this week, but some will be next week. So, so there is going to be a little bit of variation when people get a call. But if you especially if you registered online and it said you have, you know, it confirmed your registration at the time that you did it, then the RHA will get your information.
Okay, thank you. I have a question from a current migrant worker who's here on a work permit. They're wondering, will the government cover the cost of vaccination for migrants because they're not eligible for MCP?
Yes, if you're living here in the province, you will receive a COVID vaccine.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question for the Premier. How worried are you about some rotational workers who are making the decision to move out of the province to, for example, live in Alberta, which requires zero isolation when they go back and forth to their work sites?
I mean, we've all recognized, I think the whole province has recognized the stress and strain that rotational workers and their families have been under during this COVID-19 pandemic, and they're an important part, always have been, and hopefully always will be an important part of Newfoundland and Labrador culture and our DNA and our history. And I hope that there isn't a large portion of rotational workers who leave the province. We recognize their importance to who we are, and I think today's change shows a willingness to support the families of the rotational workers so that they can develop a less stressful, albeit it's still going to be stressful. I can appreciate that time of isolation when they return to the province. There's no question, Peter, it's a tough situation for them and their families, and I can appreciate that, but we hope that they still continue to call Newfoundland and Labrador home.
And a question about the vaccine administration. Can you give us an idea of how many doses a day we're currently giving out and how we expect that to change throughout the rest of the month?
Probably best for you, Minister.
Yeah, thank you, Premier. Just getting myself technologically sorted off mute here. The daily doses do fluctuate. I don't have a figure immediately to hand, but I can certainly get one for you. It really rather depends on the supply, but certainly we can find you a daily average for when we do have vaccine to administer, and I'll get that for you.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Premier, new numbers from StatsCan today show the province lost 15,000 jobs in February. What action will you take to help the economy recover from this latest lockdown?
Well, I mean, I think those job losses are reflective of the strict and quick actions that we took with respect to the outbreak, and a healthy public will create a healthy economy. And I think that it's unfortunate that the businesses and the economy were impacted, but ultimately I think we've shown that we've controlled this pandemic, or this recent outbreak is sufficient enough to allow business to start reopening again, perhaps faster, or certainly faster than we did even in the spring. We want to be there for businesses to ensure that they're well positioned to capitalize on emerging from this pandemic, and we will be, and we'll ensure that as they emerge from the pandemic, that they have the right tools that they need to not only sustain but to grow their business well into the future.
Thank you. And Dr. Fitzgerald, hearing from a lot of parents the concern about kids going back to school, we've heard it over and over, if you can work from home, to work from home. So in doing that, some parents wondering why it's safe then for kids to go to school if they're being urged to work from home still.
So the reason we want people to work from home and the reason we want people to reduce their contacts is so that we can reduce the risk and the spread in the community. And we know that if we have a safe community, we'll have a safe school. And, you know, we know that children need to be in school, especially younger children. It's a very important part of their social and emotional learning. It's a very important part of their lives. And so we want children to be able to live as normally as they can. You know, there's still lots of things that are very different about school right now with their going back. We know that PPE is protective. We know that we can reduce spread by wearing masks, by cohorting. So I think, you know, we're making the best decisions that will allow our children to be safe and to protect their well-being overall by letting them go back to school. And by the rest of us trying to do the best we can to reduce our contacts and reduce that spread, that will enable children to be able to stay in school and protect their health and well-being.
Thank you.
Our next questions are from Noah Shepherd with VOCM. Please go ahead.
I was wondering, is travel safe for those who received their first vaccine, and at what point are people better protected?
You mean travel internationally, or what, is that what you mean?
Nationally.
So, I mean, at this point, you have to think about where you're going. You know, we know that the vaccine is protective against severe disease. We don't know the effect of the vaccine at this point, or we're still learning about the effect of the vaccine on transmission. So, you know, if you're going to a place with a higher incidence or higher rate of disease, then you are putting yourself at increased risk. So certainly your risk is reduced in all likelihood of severe disease if you have the vaccine, but we certainly at this point would not be recommending non-essential travel if you're outside of the province.
So some businesses, such as dance studios, are being permitted to open in some capacity, but there's a little confusion. I was wondering if group classes are permitted, or is it only for private or individual household bubbles?
Yes, so what we're recommending at this point is for private or the individual households, and not group classes at this time where, you know, where you would be interacting with people outside of your household.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, I think you suggested, Dr. Fitzgerald, recently that you did not want to break down a specific type of travel involved in travel-related cases, in particular rotational work. And yet we did get that breakdown during the survey last October for their policy review. Why is it the public can't know the nature of that travel and see whether this is really the type of travel that's more likely to be causing imported cases?
So I think when we're talking about one individual person, it's a little bit different than if we're talking about an aggregate number of people and where the travel is happening from. So, you know, I don't like to give out the information about where people have traveled from. We have ended up with situations where, you know, assumptions have been made and people coming from a certain area of the world have been stigmatized because of that. It's not only happened here, it's happened in other places as well. So we're trying to reduce the risk of that happening as much as possible. When we're talking about travelers like in a larger number as an aggregate group, that's a little bit different. But when we're talking about individuals, we're not, we don't want to say where exactly they're coming from an individual point of view. What I will say is that at this point, pretty much any travel outside of the province will, you know, is higher risk travel. So it except perhaps for the other Atlantic provinces, but you know, so I don't know that we can actually distinguish at this point.
Okay, thank you. If we if we can't distinguish it, then why wouldn't the entry-level testing be applied across the board rather than only for rotational workers?
Because everyone else who's coming in has to quarantine for 14 days. So it's not the same risks. We're asking them to quarantine away from other people so that you don't have that risk of spread in the same way as we would with rotational workers, where we're allowing them to be around their family.
Okay. Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. It's a more practical question for people entering alert level either 4 or 3 this weekend. Are in-home services, so for example, cleaning people, allowed to go into home?
So what we've recommended in level 4 is that you can have someone come in if you need to, if it's important for the functioning of your home. So if you need care or if you need to have certain things done. So I suppose if something like that was essential, then to provide support, then yes. But if it's not essential in that regard, then I would recommend not doing that. In level 3, we're saying, there can be 10 people 10 people outside your household. So, you need to make some good decisions about who those 10 people are. And, depending, you're having somebody who comes in and clean your house, that might be very important. So I think you need to consider that. I mean, the other option is that somebody comes in when you're not there. It's a little bit different. The risk is not quite the same. So there's a couple of ways to look at that one, I guess.
Okay, thanks.
Kellyanne Roberts with NTV, do you have a final question?
Yes, I'm wondering in regards to AstraZeneca. I know you spoke about it in the preamble. I'm more looking to see when we're done vaccinating first responders, who will be next on the list for AstraZeneca?
So with AstraZeneca right now, we are working through, or we will be working through first responders. And then we've identified other essential workers. I'm not sure that we've actually defined that quite specifically at this time, but we will certainly be notifying as soon as we have any more information.
Thank you.
Noah Shepard with VOCM, do you have a final question?
Yes, I do. Is there any concern that the 2 different alert levels in different parts of the province are causing any confusion, and will they sync up eventually?
Yeah, but I mean, the hope is that they will sync up eventually. It's just, the Avalon may be a couple of weeks behind, but, we'll, I don't think, I haven't heard that it's been confusing. I think most people understand. We've given a clear cutoff of where we consider the Avalon Peninsula to end. So, I don't think there's been much confusion up to this point that I'm aware of anyway.
Thank you very much.
Peter Jackson with The Telegram, do you have a final question?
Yes, just in terms of people's anxiety about school, I think you may have already answered this, but from the data that you've gotten of last month's outbreak, how much of that school spread that sparked the outbreak is believed to have occurred in the actual classroom setting?
So certainly in one school in particular, we know that there's likely some spread that happened in the classroom setting. Eastern Health, as I said earlier, they're still working through all of that. There's a lot of data for them to mine through. There's a lot of information about contacts that they have to mine through. So it is taking them a bit of time to get there. It's almost certainly that there will be some spread within that school, just given the sheer numbers of people that we had who tested positive. But there was, there was a lot of spread outside of that as well, and within family groups for sure. We saw, multiple. Many families where everybody in that family tested positive, right? So there was a lot of spread within family groups as well, and close circles of friends, we'll say.
Okay, thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, certainly thank you all for joining us this week. It's the end of, I think, was a pretty positive, optimistic week as we continue to distribute vaccines and the numbers continue to go down. The active cases and the number of recoveries continue to go up. I'd just like to remind everyone as we continue to move levels, it's still important to follow the public health guidelines, wear a mask, wash your hands, keep your social distance, but also to support your local businesses where you can. Order takeout, curbside. Businesses have adapted in order to provide services in these levels, and I think it's important that we all support them. They've supported us in many ways in the past, whether it's through the economy or charitable organizations, and now it's time for us to give back to them. So please be there to support your local businesses as you have in the past, and until then, we'll see you next week.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call.